Hi, my name is Marissa Distel, and I will be performing 3 procedures today. I will be doing the irrigation of the catheter, the urine specimen, and the removal of the catheter. First procedure I will be performing is the irrigation of the catheter. I will introduce myself to the patient, explaining the procedure, asking if they have any questions. I will then identify the patient with their full name and date of birth, check the bracelet if they have one. I will then perform hand hygiene, and I would then put the patient in a dorsal recumbent position. You can also want to palpate and see if there's any distension. You're then going to want to clamp the catheter and flush it out with doctor's orders, and that flushes out the urine. And then you're going to want to unclamp and make sure everything is running properly. Cover up your patient and check back with them. And then I would chart, and now I will be doing the urine specimen procedure. Okay, I would knock on the door, introduce myself, explain the procedure to the patient. I would then perform hand hygiene. I would identify the patient with their full name, date of birth. I am then going to want to put on my gloves, and I'm going to expose my patient, but try not to expose them too much. Okay, and if you don't see any visible urine, you're going to want to clamp it for 15 to 30 minutes, and no longer than 30 minutes. And you're going to just clamp it just below the port. There you go. And once you see urine, you can now grab your alcohol swab, and you're going to clean the port in a circular motion. After that is done, I'm going to want to grab my 10 cc syringe with a 25 gauge needle, cover it, and I'm going to want to go into it at an angle. I will draw back my needle, once I have it all, I will then remove my needle from the port, grab my urine specimen container, unscrew the lid, keeping it in a downward position, inserting my needle and inserting my urine. Once that is done, cover my lid, put my safety cap on my needle, cover up my patient. Oh, before that, I'm going to want to unclamp the catheter. Then I would put my safety needle on, cover up my specimen container, put my needle into the sharps container, and then label my container with the date and time and my initials. And then I'm going to want to bring it to the lab, no longer 15 to 30 minutes usually, and no longer because then bacteria can grow. Now I will be performing the catheter removal of the catheter. I would perform hand hygiene, introduce myself to the patient, explain the procedure, identify the patient with their full name, date of birth. I will then put on my gloves, uncover my patient, okay, and then I'm going to want to put a couple of paper towels down there just in case there's any dribble of urine. I will then grab my 10 milliliter gauge here, and then I would insert it, telling the patient you might feel a little pressure, grabbing that. I'll draw back,